So thank you. My name is Rebecca Webb. I'm the Executive Director here at KW Counselling Services, so welcome. This is the second of 3 panels that we're doing under the general theme of connection. And this one is belonging and safety in Waterloo region. So I will start with in our work towards a community where no one is left behind. KW Counselling Services gratefully acknowledges that we are on the traditional territory of the Anishinaabe, Haudenosaunee, and Neutral peoples, and on the Haldimand Tract, which runs almost 10 kilometers deep on either side of the Grand River. I did want to say a word before we get started, because our theme for this evening is belonging and safety in Waterloo region. And when we brought this panel together, we were talking about how for most of us, sheltering at home means a lot of things, but for most of us, it does mean a safe and comfortable space. But for some members of our community, they're dealing with very different challenges. They may not have a home. They may be dealing with a home environment that is not always safe. And we have some fantastic people doing fantastic work. Helping those individuals and making sure that our entire community is served and served well. But I do want to add that it is impossible to address the theme of safety and belonging without addressing the events of the past week. This discussion's been planned for some time, and we had not planned to explicitly address racism in this evening's panel discussion, but I did want to sort of call that out and just say that we're really saddened by the ongoing violence against Black people across North America. Anti-Black racism is inherent in many of the systems in which we work and live, and I would say that is true of all of our panelists. Experience that in various degrees with the people with whom they're working in the community. So we want to acknowledge this and work towards positive change. We've been in touch with Black-led organizations, including the African Community Wellness Initiative, and we look forward to partnering on projects and supporting that work and sort of shining a light on this to the extent that we're able. So with that in mind, I'm going to turn the panel over to Rosie Del Campo, and she will introduce the panelists.
Thank you, Rebecca. Good evening, everyone. Thank you for having me here tonight. And thank you to our panelists for weighing in on what are some very important and serious topics that we need to talk about right now, especially during the pandemic. And thank you to everyone who's registered and joining in and taking part in this discussion tonight. So we're going to begin by asking our panelists to introduce themselves and tell us more about what they do. So we will start with Anne.
Oh, hello everybody. Again, thank you for inviting me to be part of this. My name is Anne Bilodeau, and I'm the Executive Director at KW Habilitation, which is here in town, and we provide support to children, youth, adults with an intellectual or developmental disability. And we've also recently gotten into of course, the affordable housing. We do have almost 30 what we call inclusive living sites all over, and of course, day program, employment services, and children's services.
Thank you, Anne. I'd like to ask Jessica now to introduce herself.
Hi folks, thanks again for having me. I'm Jessica Bondy, and I work at House of Friendship. So House of Friendship works to serve Waterloo region in addiction treatment, in housing, in food, and in neighborhood work. And I specifically work in housing and homelessness area. So overseeing our supportive housing program, overseeing our affordable housing program, and then also our men's shelter for those who are currently homeless in Waterloo region.
And Sara Casselman is also on our panel tonight. Sara? Do we have Sara with us?
Sara's on mute.
Oh, Sara's on mute. Okay.
You know what? I do
There we
Zoom all
go.
the time, and I never forget to unmute myself, except for this exact moment when it's important. I'll do that again. I'm Sara Casselman. I'm the Executive Director of the Sexual Assault Support Center of Waterloo Region. Our center supports survivors of sexual violence. We listen, facilitate healing, and celebrate the incredible resiliency of the folks that use our service. We also use an intersectional feminist approach and work to transform systems which promote gender-based violence. So we have counseling supports, groups, we have an anti-human trafficking program, we have court support for folks that have experienced sexual violence or domestic violence, and we have a really strong public education program in the community.
Thank you, Sarah. And next we have Jennifer.
Hi, everyone. It's Jennifer Hutton, and thanks so much for joining in today. I am the CEO of Women's Crisis Services of Waterloo Region. So we have Selma House in Kitchener and Haven House in Cambridge. And we support women and children who are fleeing domestic violence or need some sort of support while they're coping with domestic violence. Because we also have regional outreach programs, so you don't need to come into our shelter to have services. But we have 90 beds to support women and children in the community.
Thank you, Jennifer. And finally, our final panelist is Alice.
Hi, thank you so much for having me. My name is Alice Maguire and I work with Sanguen Health Center. We're a not-for-profit. We work from a harm reduction approach and we provide harm reduction and healthcare to folks that are experiencing substance use, typically who are also street involved or experiencing poverty. We offer a number of community services such as community health vans, mobile bus, nursing from a harm reduction perspective, hepatitis C treatment and care, outreach, and our consumption treatment services. And my role is I work with consumption and treatment services in Kitchener.
Thank you, Alice. So we'll begin with some questions for our panelists. Our first question is for Jennifer Hutton, and we have a statistic here that I want to share. So it was recently reported that at least 9 women and girls had been killed in domestic homicides in Canada, and this was between April 1st and May 4th. So we're talking about a month here. So clearly not everyone is able to shelter safely at home right now. So Jennifer, what have you been seeing locally at Women's Crisis Services of Waterloo Region?
Yeah, that number, you have to, it almost takes a minute to digest it. My sister, who knows that I work in domestic violence, actually sent me a message when she read an article that shared those numbers, and she said, "Is this true?" And I'm like, yes, absolutely, it is true. We know home is not safe for everyone, and rather it can become more unsafe during a pandemic because we know women are maybe home isolating with an abusive partner and can be very unsafe in that regard. Not only that, but COVID-19 itself can actually be used against women through further isolation, further control. There's a significant amount of monitoring that can happen. And people have been really sharing globally that domestic violence rates are going up. And they're absolutely going up and escalating. We're actually and have been seeing sort of the opposite of that. As a shelter, I mentioned earlier, we have about 90 beds. We're one of the larger shelters, emergency women's shelters in the province, and we're typically full, if not close to full. We have seen our numbers at 50, 60% since the pandemic started. Even calls to our 24-hour support line went down. So that was quite concerning for us. And I think that's happening for a bunch of different reasons. We know obviously if a woman's isolated with an abusive partner, it's likely not safe to reach out and to make that call. One thing that we did rather quickly, as we know that it's just that much harder to pick up the phone and make a call, we very quickly added an online chat feature to our website. And recently had a woman come to shelter through accessing the chat feature and said to us, you know, she may have not been safe otherwise if she didn't have that option to reach out. So like everyone, we've had to do things quickly and a little bit different than what we're accustomed to. Our shelters have been open throughout the pandemic. You know, we're wearing masks, we're doing all sorts of different precautions to make sure that women and children are safe, screening. And it's not been an easy time for women to stay in our shelters because they're having to come in, they're having to isolate for a period of time for that safety. And we've been fortunate that we have relatively new shelters, so we have individual bedrooms and bathrooms. So that's made that part a lot easier. But it's not a great time for women to come to shelter. And when it's not easy to reach out, which is already a hard decision, and there's a number of barriers that make it hard for women to make that decision to leave an abusive relationship, add in all the other parts of the pandemic that we're dealing with, and it just gets layered and layered. The good news is we're starting to see those numbers come up because we know domestic violence hasn't stopped. It's increased. So it's really worrisome when people aren't reaching out, but we're starting to see our numbers slowly get back up to what they should be. So that is encouraging as things start to open. But we're really fortunate that we have the staff in place, and we're getting some additional services back in shelter that women rely on and children rely on and that really make a difference for them, such as our music therapist. We've slowly added her back. Our mental health expert, we're slowly starting to add her back. So that's been good. We're starting to get more into the rhythm of things, but it's not been easy. So, but it's good to know that things we're starting to see more people reaching out again. And we've really been stressing to everyone in the community. We're from Waterloo Region. We're from just a fantastic community. And I think we have this sense of really looking out for one another. And we really have been asking people, if you're concerned about somebody, check in with them, look out for them. And that's been really helpful to have everybody kind of take care of one another.
Thank you, Jennifer. Do any of our other panelists have something they'd like to add? All right, then we will move on to our next question. And this one is for Sara Casselman. Sara, last year, Waterloo Region was rated the least safe major urban center in Canada for women. And this was in a report issued by the Canadian Centre for Policy Alternatives. So can you speak to that report and tell us what this looks like now in the context of COVID-19?
Absolutely. Before I begin, though, I do want to say a special thank you to Rebecca and the folks at KW Counselling for inviting us to be part of the panel tonight and your 70th anniversary celebrations. I think having community in and amplifying the voices of your community partners as part of your anniversary says a lot about your organization, so thank you. So the report that Rosie mentioned was the best and worst places to be a woman in Canada 2019. And the 5th annual edition of that report was released last March by the Canadian Centre for Policy Alternatives. So that report basically looks at gender equity and says whether or not men and women in communities have equal access to opportunities and resources. And so I looked at it across a variety of different factors, but one of them was personal safety, or basically experiences of violence. And so Waterloo Region last year, based on mostly police reports, was rated the least safe major urban center in Canada for women. So that was based on domestic violence reports, sexual assault reports, and criminal harassment reports, or stalking. And I could have actually, when you asked whether we had things to add to Jen's, I knew I was going to be saying this right next, so I didn't. But you know, when we're hearing Jen speak and you're hearing me speak, we are, you know, kind of core in terms of addressing violence against women in our communities. And we were rated just last year the least safe urban center for women. So it is a really concerning issue in our community. And so at that time, when the report first came out, folks in the media, general community partners were asking us, like, do you actually think that we're the least safe city for women? And a lot of that came from the fact that the report used police statistics mostly. It used other things too, but mostly to make those numbers up. And the argument could be made that higher police stats actually mean that a community is doing better in terms of reaching folks and folks feeling safe to reach out, because we know that only 5% of sexual assaults are even reported to police in general, and about 30% of domestic violence cases are reported to police. So the vast majority of violence against women in our communities isn't. And so from the perspective of a community-based sexual assault center, were we the least safe? Well, I usually answered that question by saying that we have seen a cultural shift, and I know people who hear me talk about this all the time, but it's so true in our sector. 5 years ago, so Bill Cosby, Harvey Weinstein, Jian Ghomeshi, sexual assaults in the military, the armed forces, on college and university campuses, concerns over police responses to sexual assault. So there was just like headline after headline. And what happened is that more survivors with each reached out. And then Me Too hit, the hashtag Me Too, the Me Too movement. And our center was flooded. So 5 years ago, I've been working in this sector now for 18 years. 5 years ago, we started to see this increase. And if we had, at that point, 40 survivors on our waiting list for services, we would have said we're in crisis, because every survivor who calls needs support then. It's not the kind of thing that you say, you know, I'm calling now because I'm going to need support in 6 months or a year. And so 5 years ago, 40 survivors was very concerning to us. For the last 3 years, we've been averaging 140 survivors on our waiting list. So the thing that I often said in response to this is, whether we're the least safe city, whether we're the 5th least safe city, like whatever that nuance is, does it even matter at this point? Because violence against women is a significant issue in our community. The report is saying that. From a sexual assault center, our waiting lists are huge, they're overwhelming, and it's time that our community prioritize this issue. And so that's the message that we were sending out last year, and a lot of our community partners and supporters were helping amplify that. So as Jen just said, during wars, natural disasters, pandemics, violence against women increases in our communities. So when we're already in crisis as a sector, and now we're in a pandemic where we know the violence is going to increase, and we've already started to see that in our human trafficking program, for instance, and other things that's happening at our center. And that long-term aftermath, like we know that that folks who are experiencing sexual assault within the context of domestic relationship or childhood sexual abuse, those things will come out in the aftermath. This is a really concerning time for women and for survivors of violence in our community, truthfully. So I would echo what Jen said in terms of the need is going to be greater than it even was before, and we were already in crisis. So this is where we are really calling upon our community for support for women's organizations like shelters and sexual assault centers. And we are over the last few years, we've seen the community really embrace this issue. With more survivors reaching out, there's also more people engaged in this issue than ever before. So it is really hopeful to see that we're in the midst of a cultural shift around violence against women.
Thank you, Sarah. Do any of our other panelists have something they'd like to add? Okay, we will go next to Alice. We have a question about substance use. So what are some of the specific challenges facing people who use substances during this time?
Hi, thank you so much. We work with folks who use substances, and there's, like many sectors of society, COVID-19 is really just heightening the barriers that already existed. So we're seeing an increase in things like stigma, an increase in further social isolation. We know that folks who use substances, especially those who are in poverty and street involved, are already experiencing a lack of connection and community, increased stigma, and then heightened overdose risk. So we know that people who use drugs before this pandemic was happening were already experiencing another crisis, right? The opioid epidemic. They were facing an extremely unpredictable and toxic drug supply that was killing them, and it continues to do so. And so right now, what we're seeing is a necessary shifting of services. So services have shifted to be virtual and online. And when you're not housed, you're not able to access virtual and phone counseling and supports. And then the people that you counted on to connect with you are now connecting with you with a mask on. So you already know that the community views you as less than valuable than other community members. And then the person whose smile you counted on that day, because you were the only person they connected with, they're covered in a mask. And it's a lot harder for folks to connect, to feel valued, to feel that love and care that we need. And the increase in overdose risk has happened because we've had interruptions in the drug supply. So the drug supply is even more toxic, even more unpredictable. We're seeing folks experiencing a ton of overdoses. There's been an overall spike in overdoses across the province. We've seen it happening here in Kitchener. Guelph has experienced a number of fatal overdoses. And we're seeing highs that we hadn't seen for months and years, because we were actually starting to get it together in terms of addressing the opioid epidemic. And then COVID hit, and we're sort of ripping away all those progresses we've made. Jennifer talked about decrease in accessing services, and one of the kind of amazing things that happened in this community as we mobilized really quickly to bring support to folks who use drugs who are living in poverty. We housed them and found different services and integrated services in like a truly beautiful way. But one of the negative outcomes has been that, for example, people aren't downtown, and that's where consumption treatment services are. That's where a lot of downtown services were. So we're seeing less folks coming to get well, less folks coming to use safely, and they're unfortunately having to use in different ways. Also, the strategies we use in order to keep safe from COVID-19 are directly in opposition to what we tell folks about using safely. We say, always use with a buddy, always make sure you're with someone, they'll respond to your overdose. And to prevent COVID-19, we say, keep your distance. So folks who keep their distance are more likely to get have a fatal overdose because they're by themselves and they can't respond to that overdose. And then folks who aren't able to distance are at a greater risk of transmitting the virus. So it's a really challenging situation. And I think I will probably leave it at that, because if I don't, I will never stop. So thank you so much.
Thank you, Alice. Do any of our panelists have anything they'd like to add to that? Thank you. Our next question is for Sara Casselman. What are some of the unique challenges, Sara, right now facing LGBTQ youth who are sheltering at home during the pandemic?
So I'm speaking on behalf of just as a member of the LGBTQ community, not so much as someone that does direct work with them. But I do know that right now there are a lot of youth that are in unsafe, unsupportive homes. And a lot of what we try to do as a community is embrace those youth and wrap them in community care, make sure that they have networks and supports that see them, that recognize them, that celebrate them. And that is so hard right now with the reality that people are supposed to be physically distant, that a lot of the programs and supports that people went to don't exist anymore, or only happening online. And if you're in an unsafe home and being online at home isn't safe for you, that's not there as an option. So I just think that as a community right now, we need to really be intentional about messaging for our queer youth and letting them know that that we understand the situation that they're in the sense that we see that they're in an unsupportive home, and make sure we get connected, like honestly, KW Counseling and the OK to Me program, and in general, just make sure that the messages are out there that this time will pass. They will be eventually in a place where they're experiencing joy and comfort and security amongst people that care for them. So I know it's a really simplistic message, but honestly, just keeping an eye out there and putting messages out on social media, letting folks know that you're a safe place for people to talk, because it's so vulnerable to be a queer youth in an unsupportive home. And at this time, just so challenging. And we know that our youth are at risk of suicide and things like that. And this is a time where we really need to be watching out for them.
Thank you, Sarah. Do our panelists have anything else to add?
Hi, that's Alice. Yeah, I just add a little bit to that because I think that's absolutely the message here. I mean, also speaking as a member of the community, and I did work for OK2Me for a number of years, and I know, and we all know how important as a young person connections with our peers are, right? And the loss of that is so significant in a person-to-person way, as well as the importance of queer adult role models. And here we are, it's Pride Month, and I've been talking to people who this was going to be their first Pride, right? And to not be able to be out in the world as your authentic self is tragic, right? It's okay to be me, GSAs in schools, sometimes those are the only place a person can be their true authentic self. And I know I've known people in the past who dread summer holidays because they go back into the closet and now they haven't been in school for 3 months, and that'll continue for summer. So that's almost half of a year that they're back in the closet. And that is, it's really an awful thing. And on the positive or the place of hope, we know that youth are more tech savvy than everyone else, and so many of them are already connecting online virtually, but I don't think it's enough. And as Sarah said, there are many homes where that virtual online phone presence is policed by the other folks in that home, and so it's not safe, and we're not able to do that. So
I do also think that our school boards have a role to play in terms of the messaging that they're putting out and the supports that they have for queer youth. And so I know that that's a particularly sensitive issue in our community right now. And I encourage our school boards to make sure that their spaces are safe and welcoming and celebratory and inclusive.
Thank you, Sarah. Absolutely.
Thank you, Sarah and Alice. Our next question is for Jessica. Jessica, we know many people in our community experience homelessness. So what can we do to improve the shelter and the housing space to create a new normal?
Thanks. Thanks so much, Rosie, for that question. Yeah, COVID has been challenging, as you've heard from so many of these panelists and our organizations, and how we're able to support folks. The big mandate came out to shelter in place, and what does that mean, or what does that look like when you don't have a home, or when you're asked to leave a shelter at 9 a.m. and not come back until dinner time. It's really difficult to conceptualize what life has been like for some of our folks who are homeless. At House of Friendship, we support participants who are, obviously experiencing significant trauma and challenge in their day-to-day life. These are folks who have had very complex lives up to this point. Many are navigating addictions and complex mental health and physical health challenges too. And what it means to be homeless in a place where you're asked to leave during the day, or where you don't have a place to belong because community meal programs are being shut down, it can be very challenging. One of the things that has been so positive about COVID-19 is it's really allowed shelter providers and housing providers to evaluate the current practices and really focus in on the needs of participants. So one of the things that I'm so excited and proud about is that we've actually been able to relocate our shelter and increase capacity. So we went from serving 51 men to serving 80 men, and likely will continue to increase as that need in our community continues to expand for folks who are homeless. But we've also been able to extend our hours. So we are operating a 24/7 shelter for the first time ever in our community, which is absolutely incredible. I mean, for folks, they have a place and a space to be where they are welcomed, where they feel supported, where they can be connected to the resources and the staff team that care so much about their well-being and their health. We aren't operating out of our current shelter location. We've actually had a hotel angel who has worked alongside us to provide an incredible service to these men who are struggling with homelessness. And in that space, we've been able to really be nimble and solve problems and be creative. a number of months ago, House of Friendship launched this really bold vision to think about how we might integrate healthcare and sheltering together to best support people who are experiencing homelessness, because we know it's not as simple as someone who maybe lost a job or had a family breakdown. We know that very often there's immense childhood trauma, that there's possibly alcoholism or substance use challenges, and then physical illness that has come along with sleeping on the streets or sleeping rough, or having diabetes and not ever having access to proper care for something like that. And so at our new hotel location, we've been able to start to dabble in some of these really cool pieces as a result of COVID. So it's been quite positive for the folks that are staying with us and in that location. We've got a primary care team who are on site 5 days a week. Every single one of our shelter participants have accessed primary care throughout the duration of their stay, which is unprecedented. Previously, we offered healthcare in our shelter 1 day a week or twice a week for 3 hours. And because it's consistent and ongoing, we're really seeing the quality of care. And what that means is that people are feeling more like themselves. They're getting hope. They're well rested. And so I did want to share just a quick quote from one of our participants. And this is someone who made the transition, was staying with us at 63 Charles Street and then moved to our hotel location. And he said, for the first time in a long time, I feel like I'm ready to tackle my addiction. Because of the conditions at the new hotel, I've been able to see a healthcare provider for the first time in over 5 years. I'm sleeping. Really sleeping, and I'm starting to feel like me. Thanks to the hotel team and the shelter team, I've realized that I have a life worth living and that I can do this. And so we have been benefiting and supporting people in incredible ways during COVID-19, and we are so excited as we continue to bring partnerships in this community together to revision what shelter looks like in this community. What we've seen, the targets and the outcomes from the people that we support and serve, and the relationship pieces from our staff side. As hard as it is to wear PPE and to engage in conversation and day-to-day relationships in that way, we're making a meaningful difference, and we're going to continue to move forward and shelter people in a way that provides dignity and hope and helps people feel loved and supported and welcomed in our community. So we're really excited about the benefits that actually COVID has had for this population, and how we're now dreaming about a better way of doing something for the first time in a long time.
Thank you, Jessica. Do our other panelists have something they would like to add? All right, thank you. Our last question is for Anne. Anne, we know KW Habilitation had to close its day support programs during the state of emergency. So how is that affecting the families that you serve?
Thank you for that question. And I did want to also send out a huge kudos to Rebecca and her team, and a huge congrats on 70 years for KW Counseling. It's hard for me to believe that I've been around for 43 of those 70, but anyway, I won't go there. Anyway, I also wanted to point out that people with an intellectual disability or developmental disability hits every one of the services that we have chatted about here today. And I think sometimes there's a misunderstanding that the stroke the broad stroke that we often use for people with developmental disabilities is very contained. Well, in fact, it's not. I have a story as recent having to deal with today where someone has left one of our sites because they don't want to be there anymore. They don't understand what's going on in terms of COVID completely. They don't understand that they can't go out but they want to be on the streets. And there certainly is a drug issue there too. So, you know, we have to work in all of these worlds. Human trafficking in our transitional aged youth has also been prevalent. And so we've had to certainly make sure that we're engaged with everyone on the panelists. Abuse is also another one. For those who are living at home or living with family or living with a partner, we constantly need to ensure that we're keeping an eye out and that we try and teach and train. And so just so you know, I just wanted to make sure that's clear that we're all engaged in this together. The question that you're asking is around our family. So yes, we did have our day options have to shut down immediately as of March the 15th. And so for those who were able to go into our inclusive living sites, we were able to continue much of the work. But for those who were going home or were living on their own or without supports, that's the area where we had some real concern, because all of a sudden isolation was major. And I'm looking at the list of some of what some of our panelists has been talking about, and things like socialization, that's huge. And all of it, but don't forget, they don't necessarily have Wi-Fi, no cell, and so again, those are all issues. Many of our families are aging, have aging parents, and so again, not having access to any of that communication. We immediately, of course, started communication, and our team actually started connecting with families, and we provided wherever we could, we provided some of the technology if they were willing to, but again, very difficult. Talk about a learning curve. So the concerns there have been really quite great, and so. But the real problem here is, what is our new norm going to be? What's it going to be like tomorrow? Because it was large, well, not large. Our philosophy was small, of course, inclusive and in community, but it's still, you could still have a group of 5, 10 people. So I think there's a lot of fear and anxiety right now. We're also quite concerned that we're not getting the information we need to know as to whether or not they're in crisis, or is it, we get that sense a little bit, but and no one, they're not on anyone's radar necessarily, even when it comes to statistics. We don't know if anyone in the family had COVID, or they were in contact with anyone with it, or are they part of it. We of course, in our services do, but not for those who are at home. So we really feel that it's important that we step up, and we are making those connections, and we're also actually developing under public health authority guidelines. We're going to make sure that we do start knocking on the door, that we start doing some of the outside, of course, can only be outside right now because of the emergency order. So those are all really important. So we're keeping in touch. We're making sure the contact is there. We also have provided meals. So one of the other, we flipped over, just like everyone else. Boy, have we had to flip over stuff. So our 99 Ottawa Street has turned into a pretty major food hub, all under public health guidelines. And so we've actually making meals for 5 days. So we deliver them on a Monday, for 5 days. So those are all things that we had to jump to immediately to ensure that people had connection. Then there's the social side of things, and the social side of things, again, so think about it. The comprehension may not be there. Some just don't understand. Self-isolation, that's been a little tough. So we've had to certainly make sure that all of our guidelines were met, and actually we needed to do more. And so we did. So we were fortunate that we mobilized immediately. We have a containment site also that, thank goodness, knock on wood, we haven't had to use, but we're ready and prepared. And one of the key areas was for those families. Because what would happen if, and it happened in Ottawa, where 2 family members got sick with COVID, and the adult child was in crisis. So what we did locally was we were prepared for that. And so we set up sites in which to, we haven't fortunately had to do that as of yet. But maintaining communication, even if it's via the phone, even if it's a knock on the door. So today's talk is about the vulnerable neighbor. And so I do encourage anyone who happens to know of someone in the neighborhood that might need a knock on the door to please do so. I think there's another part to this, and I know it's part of my question too, and is there a silver lining? I don't know about all of you, but I've been saying it quite a bit lately. We jumped a decade in a weekend, right? So when it comes to technology, those kinds of things, it has been unbelievable to see people with an iPad, and actually, you know, us going through the training and with families, and even family members that are like, meow. But when you're forced to, because guess what? I want to see my grandchildren, so I better learn how to do it. Right? They were forced to, and then guess what? They're doing it. And so to me, as horrible as all of this has been, we need to look at the silver linings. And Jess, you mentioned a few silver linings. All of us have the silver linings. So we need to take this tragedy and we need to look at it and say, what did we learn? What efficiencies are there? I don't know about all of you, but even with the families, they're going, you know what? It's not so bad at home, and it's not so noisy back where I am sometimes during the day. Or, oh, if I actually have somebody come and they're going to do something with just me and that person, we're going to go do something, that's actually being welcomed. So I think sometimes what we thought was great, we always had the philosophy that individualized and self-determination was the #1 priority. So guess what? We get to jump forward and actually do this at a much faster pace than we had ever thought. So I do believe that there are some silver linings here that we all need to, when all this is done, hopefully sooner versus later, that we get to actually sit down and go, okay, what did we learn? And meeting all of you and us working together is another part of it, because I know we can certainly help each other out during the tough times, but as we move forward, let's do more together. So if any second wave comes or anything else happens, we're ready for it. So.
Thank you so much, Anne. I wanted to turn things over back to Jessica just very briefly, because there was a question in the chat portion of our video conference here, just asking more about what more can be done to help improve the situation at local shelters. And I just wanted to give you an opportunity to respond vocally and verbally, Jessica, to that question.
Awesome. Thanks, Rosie. Yeah, so there's always a way you can help, right? This isn't hopeless. You know, our real goal at the shelter is to one day close our doors, right? We don't want to provide that service. We really do want to house people and get people housed. And so a lot of the work that many of the folks in the shelter system do is we work diligently on supporting housing plans. And obviously housing in our region is hard to come by, especially if you're living on low income, or if you're living in poverty, or you're on one of our government subsidy programs. So one of the key pieces that you could do is become a real advocate for supportive housing, which is where someone with high acuity or lots of complex needs can live with staff there to support them to be successful, and slowly work along developing goals and building self-determination and hope, and creating positive neighborly relationships, those types of things for folks who are homeless. We've got a whole suite of programs and housing really dedicated just to supporting folks who are recovering from homelessness. So that's one area where people can show support is in that. As well as our affordable housing programs. We know for families who are experiencing homelessness, or couples, or you know, even some of our you know, students accessing universities and colleges, finding affordable housing options is really tough in our community. And so making sure that you're listening in, that you're reading up, and that you're standing in and hoping to support those programs. There's also other things you can do. You can check out our website. We're actually, we've got community members who can send in a note to someone who's homeless or someone in our housing units, just a note of encouragement to let them know that they're being thought of and cared for in our community. So that's one way. Another thing you could do is, if you come across someone who is homeless, or someone who looks like they're maybe having a really hard day, just treat them with kindness, right? Just help them feel connected and supported and like they belong in our community, right? Even more than ever, just feeling like you are being noticed and welcomed goes a long way. And of course, you can always donate to one of the great shelters or any of these amazing organizations and share, you know, what we're sharing with you today with someone you're close with too.
Thank you, Jessica. We have a question from someone who joined us on Zoom this evening. I'm going to open this up to our panelists. I'm just going to read it here so that everybody can hear. And if you are joining us on Zoom tonight, thank you for registering. And if you do have a question, feel free to type it in and we will present that to our panelists. So here's a question for Sara. What supports are available for the long waiting list for services?
Yes, so the waiting list that we have is specific to survivors of sexual violence who are reaching out for counseling and advocacy. So just to be clear, there isn't a waiting list for our anti-human trafficking program or our court support program. And so we do have a variety of things in place to support people as best as we can. We have our 24-hour support line, and with COVID, we actually doubled the capacity on that line to respond to calls in the community. We also have groups and workshops, and until the end of March, those are always in person, and we really quickly started offering online groups and workshops. Our website, under our services, under counseling, and also on our events calendar, has about 3 different groups that are running for survivors every week right now. And what we found is that we hadn't ever done virtual groups before. And so what we're finding surprising is that our numbers are actually way higher than they've ever been. And it's all virtual, but folks are at home. Survivors are struggling now more than ever. Right now, our folks reaching out for support, survivors of sexual violence, has been pretty consistent for us. We haven't really seen a shift with COVID, but our consistent is very, very high. The thing that we're seeing though is that the survivors that are reaching out and the survivors on our waiting list and the survivors that are accessing counseling a lot of them are feeling triggered right now. So, you know, survivors are dealing with the same thing that we're all dealing with, but when you've had that experience of trauma. So, you know, anxiety, isolation was the worst thing, depression, those kinds of things. And so they're needing more supports. So groups and workshops are an option. Our 24-hour support line is an option. We always, when we do intake with someone, and I hate this word, but for lack of a better word, we do have a bit of a triaging process. If someone's in significant crisis, we do try to get them in, or if there's been a really recent assault, or if they're our teenager, we always prioritize as well. And then we have a list of our key community partners that have walk-in services or the equivalent of those kinds of things. And we do make those referrals, but as the community-based sexual assault support center, a lot of folks are reaching out to us because of our very unique expertise. And a lot of them are saying, wanting help with a very particular thing, or wanting help with advocacy through the court system, and how that's all wrapped up in the counseling, because going to court creates anxiety and needing support after that, and even during the court process, and those kinds of things. So we offer supports where we can. We do triaging. We have groups and workshops and our 24-hour support line, and we rely on our community partners, and we're relying on our donors and our local funders and our provincial funders and our federal funders to actually say that survivors shouldn't be waiting anymore, and the funding should be in so that survivors aren't waiting.
Thank you, Sara. And again, if anyone has any questions, feel free to type them into the chat portion and we'll present the questions to our panelists. I'd like to ask our panelists if they'd like to answer this question. We know that long-term care homes, retirement homes, the pandemic's really taking a toll on these facilities. What made these systems so vulnerable in the first place, and what can be done about this?
I'll take that one. looking at long-term care, and I've worked with them in our community, I think we need to acknowledge that congregate care, whether we like it or not, has been a real feed to this horrible disease, and I think our horrible flu. So I think what's important is that we need to recognize the system and what it looked like. I truly believe you're not going to see that anymore. All of us, when we get to that stage, and okay, I might be there before you guys, but it won't look that way. I don't think you'll see 4 in a room. I don't think you'll even see 4 in a hospital, quite frankly, ever again. So don't worry about semi-private coverage. So the reason why I smile is because that's the reality. And it was certainly right off the bat, the PPEs, all those kinds of things, I think is what we've recognized. Now I have a setting where we did have a larger number. We've tried for years to depopulate that home. And quite honestly, it is by far the most economical way to have people live. I'm just being honest, but it's philosophically, that's why we got into affordable housing. And that is so we could start moving people out. So when this started, we had a place that had 15. We immediately moved out 6 or 7 people. Immediately. So into smaller settings, we had, thank goodness, we had brand new apartments that were open and ready to go for others. And we said, nope, no one's coming in. It's going to be for that group. And I truly believe that that's what part of the reason, because I was very fearful of that site. You have larger number of staff coming in and out. You've got a lot of part-time staff. And I'm telling you, and we know it, the research is there that says because of the wages being as low as they are, everyone needs at least 2 jobs. And so that means 2 different sites. So I truly believe that wages is a big piece. Certainly congregate is a big piece. And I believe our government has made it clear that the value of our workers, and mine are included in this, are essential, and they have been devalued. And I think it's happening with everyone here too. That pandemic pay is a big deal. And I'm hoping that they continue and recognize that you can't say that for a short period of time and then say they're not valued after August the 13th. So for me, those are the 2 big areas. And I believe that LTC obviously is in the same boat.
Yeah, I would echo so much of what Anne just shared. I mean, our shelter system is completely congregate, right? So we focus on how do we get as many folks out from the cold or out from the heat, and do it as economically as possible. So when we look at our funding, it's actually 50% of our program is funded, and the rest is all donations. So yeah, something's got to change. Something has got to change, because our people deserve better. Our staff deserve better. And I believe that as Anne talked about those silver linings, there is a huge opportunity to learn from the mistakes that maybe we've experienced in the past and create a really innovative, trauma-informed way forward for people who frankly deserve better in our communities. And whether that's in long-term care or in shelter or survivors, like, we have the chance and the opportunity to do it. And Waterloo Region is such an innovative community. If there's a community who can do it, it's us. So I'm so excited to see these partnerships continue to flourish and how we can make awesome stuff continue to happen.
Thank you to all of our panelists for your time tonight, and thank you to everyone who joined us for our discussion this evening. I'm going to turn things over to Rebecca now.
Thanks, Rosie. So we knew when we were setting this up, we had a pretty good idea that, and when we looked at the panelists that we had and the areas that they were working in, each one of the questions we talked about tonight could have been their own panel. I mean, all of it is there's such just rich information and discussion available there. So I wanted to thank you. So we know we were asking sort of a lot of our panelists and of our audience this evening, because that was a lot of information and just a lot to process in terms of the work that is happening. It absolutely knocks my socks off. When I think Anne, you said like we jumped forward 10 years in a weekend. I think some of the work with vulnerable populations right now, it's not toothpaste we can put back in the tube. So I am grateful for that. I did want to thank you all for joining us tonight. I know we asked people to register without saying that there'd be homework, but we did want to ask everybody who's seeing this or everyone who streams it later. We've had questions about how people can learn more and how they can contribute and how they can participate. So our ask of everyone who's hearing this is to, I mean, if this speaks to you, if this resonates with you, please participate in this discussion. And that might mean donations to one of these organizations doing outstanding work. It might mean a letter to your MPP to sort of say, we want more for our community, and we believe that there is a different way of providing shelter care. We believe that there is a different way of providing responsive services for victims of sexual assault. So there's letters, there's reaching out to the organizations and following them and learning about them and promoting them on social media. So we are going to have, when we post the video tonight, we're also going to have some lists of some resources, the websites for the organizations, and some ways that you can participate in this discussion. Connect with the organizations you heard tonight. We'll have easily accessible social media accounts, and you can find out what we're working on and how we might be able to help you. We have a shared responsibility for one another. So we hope the panels brought some awareness to the challenges being faced by our neighbors. And as things continue to evolve, our organizations need the help of this community to design the new normal, to set expectations about what that's look like. So please stay connected with everyone here, and we'll have ways that you can do this. Thank you, all of you, for your time this evening. That was, it is such a hard discussion, and it is the hope and optimism at the heart of it is I think so much more precious because of that. So thank you for that. We've got one more panel coming, which is going to be Ways to Mental Wellbeing, and that's coming on June 18th. So invite everyone to join us there. But thank you to all of our panelists. That was amazing. And thank you to Rosie, our very, very gifted host, for moderating all of this and keeping us all sort of connected to one another and keeping things flowing smoothly. I could not do that in 100 years. I don't know how you do, but I'm so glad that you do it.
Thanks for having me tonight. This was a great discussion. Thank you.